Good afternoon. We're here with Humboldt County Health Officer Dr. Teresa Frankovich for the Friday, June 5th media availability. Thank you for being here with us.
Hi, thank you.
Before we get started with questions, can you talk a little bit about reopening and what we're looking at going forward?
Sure. So we've been on this road a little bit for a little while now, anyway. And so I think people are beginning to sort of get a flavor for how this goes. What the governor's office has signaled on this is that they are providing guidances for many of the sectors that we have had non-operational, and that as those guidances are released, then local officials are able to provide those to the community. That the community can use those for planning purposes for opening those sectors of business, for example, and that in our area, with approval of those, then and a trigger date, we're able to move forward with opening them. So, most recent example is the governor is expected today to release several new guidances. I think 11 or 12 today, and these guidances range from things like schools, day camps, camping, hotels for tourism, film, TV, and music production, pro sports without an audience, bars, wineries, gyms, zoos, museums, all kinds of things are on that list. We have not seen the guidances yet, but we know the guidances are created by often the industries themselves as well as Cal OSHA with input from public health. So we will be reviewing those guidances when they come out. My understanding is the state is basically putting them out with the guidance that they should not be moved on before the 12th of June. Part of that is waiting a little distance out from Memorial Day weekend and from some of the other things that have been happening in the community, like protests recently. And then looking at conditions on the ground in every county and then deciding how to best move forward through this group of sectors that will have available guidances. So we'll be reviewing all of those. We'll be then talking about what's next and how that's going to unfold in our area. I think the common theme across these, though, is that, again, they're going to look different than we're used to. And so, gyms will look different, and hotels will have safeguards in place. And when we're ready for some of these other entities, like zoos and museums and things like that, again, with social distancing, with masking, with sort of internal safety procedures, hand washing, sanitizer, all of those things, those are going to form a lot of our protections as we interact in those spaces. So again, I think the emphasis on both the fact that everything has to be constructed through this lens now of trying to provide COVID protection, and then us looking at our data locally and making sure that it's a good time to move forward. And the combination of those two will kind of guide us as we go through this summer.
Excellent. Thank you so much.
Thank you.
We just have a few questions from media today.
Okay.
There are new studies showing inflammatory conditions and organ damage in people who have recovered from COVID-19. Is public health tracking the long-term effects on residents who contracted the virus?
So it's a really good question. Certainly, as we're watching these cases unfold across the country and gaining more experience with this virus, we're realizing that while many people have very mild illness and likely have very little in the way of persistent problems related to it, there are individuals who have had cardiac or kidney or even neurologic issues related to this virus. And so it is not clear that this is going to be a benign course for everyone who recovers from an infection. And I think, again, it speaks to the idea of that while we understand that we are going to get some infections moving forward, we really want to emphasize that people who are most vulnerable are protected and try and remain out of the mix as much as possible, because those individuals are at higher risk for some of these complications. So it's really important. In terms of our follow-up on this sort of thing is not usually done by local public health. Follow-up on these kind of conditions are usually done through clinical research projects. Most of those come from academic centers, but certainly we'll be following this information closely. And then if there's a need for assistance in terms of helping to identify patient lists, making patients aware that there is interest in following up on their condition, that type of thing. We can serve that function, always with their consent.
Can you please describe what kinds of self-care and treatment you recommend to people experiencing any symptoms of the disease?
Well, again, the symptoms for COVID are wide-ranging, and I'm sure most people have seen the symptom list now, but we're talking about a variety of things from respiratory illness to individuals having some gastrointestinal symptoms like vomiting or diarrhea, sore throat, headache, muscle aches, those types of things. So for most individuals who are going to get a more mild disease, just symptomatic care. So the same things you would think about with flu. So using something for fever if you're uncomfortable, lots of liquids, making sure that you're resting, all of those things will be important. The other thing I think is people just need to be aware of when they're feeling worse. Some people will get more significant illness, and so feeling short of breath, feeling uncomfortable in that way is a really important indicator that you need to be seen. If you're somebody with underlying medical conditions, are more vulnerable because of your age, then you should be reaching out to your provider and really making sure that they're aware of how you're doing. We do know with this illness that some people may feel pretty good, but actually have a low oxygen level. And so, again, if you're one of the more vulnerable in particular, you should be making sure that you reach out to your provider.
Has the Optum site been able to test to capacity on a daily basis? And at this point, how many tests can it run per day?
So the Optum site has the capacity to collect 132 samples per day. That's what they're able to book for appointments. And then, of course, that testing is run off-site. It's not run at the fairgrounds. So we have run, in general, we're rated very high for the state because we're generally over the 85% full, which is really good. And so we're really happy about that. But, of course, we would love it 100%. And we want to make sure that that asset is used as well as possible because we want that information. So, again, we just encourage people who are interested in testing to go ahead and use the site and get tested. No one really needs to be tested more than every couple weeks, but if people have an interest in doing ongoing testing, we would really like to see that.
Excellent. Thank you so much.
Thank you.